And finally, AbbVie, our event sponsor, is a terrific company that has worked with us to highlight ways we can save lives, money, and suffering with renewed focus on prevention. We at the CPH Foundation are grateful to their partnership and support, and I really want to underline that because it's tougher and tougher for corporations to support this kind of initiative, and without AbbVie, we wouldn't be here recognizing these heroes and champions of public health.
Good afternoon on a sunny day in Washington. I'm old enough to have gone to medical school almost before antibiotics. And in the days I went to medical school, it was all prescribed. You did what you were told month after month. But we had one elective, and my elective back then in 1961 was preventive medicine, and was trained by a man named Mark Lepper, who was one of the real giants in the movement many years ago, and had opportunity to see and learn about what you folks are up against in trying to educate the public and policymakers, for that matter, about what is important about preventive medicine. Why do we have public health departments? What a waste of time. Why do they go in and inspect all those restaurants and close restaurants? They close my favorite restaurant. You hear that kind of stuff all the time. I had an experience very early which had a very profound impact on me, and that was I went to Africa with Operation Crossroads back in 1961. And I was a kid from the Middle West, and I was in medical school at the time. I was the only one in my class that read the entire book on tropical medicine. And I went with these kids from the very best schools in the United States. They went to Harvard and Yale and the Military Academy and Amherst and Williams and all the rest, but they did not believe in the germ theory. We had some orientation over here at George Washington University, and they were told about, malaria is a bad disease. Well, yeah, of course. And then they got over to Africa and they looked around, they saw these people eating all kinds of stuff, and they said, well, they're not sick, why can't I eat it? And so then they got tired of the sleeping nets and they decided they weren't. In that group of 17 people, we had 2 go to the hospital, one with serious malaria and one with real digestive problems, accumulated from not understanding how close we live to the interface between health and disease, and educating and getting people to understand prevention. It's always been my belief that an awful lot of the cost in this country's healthcare system could be prevented if we had a real preventive health system that functioned for everyone. It functions for some of us up at a certain level pretty well. And all of us, I've got every shot in my body that you could possibly have. I've actually had 10 yellow fever shots. You can only get one, or 7 of them. You can only get one every 10 years. And that kind of prevention is available for some people, but the rest of the society has no idea what's going on. And the CDC collects a lot of information. They get all kinds of stuff, but we don't have the ability to get the American public to really understand it. So it's a real pleasure to be asked here to come and applaud you all, not just the winners tonight, but all of you for your efforts in public health. It's no surprise to me that 2 of the winners are from Seattle, actually. Ms. Wallace, who I guess I'm not gonna give her anything, but I got to know her when I was in the legislature in Washington State many years ago before she came back here to Washington and made her wave-making career. But it's my real pleasure to introduce and present an award to Jim Krieger, who is at the County Health Department in Seattle. We've worked hard on our efforts to do public health. And we were one of the first places that did needle exchange, and we've been doing all kinds of things. And our health department was always out on the cutting edge, and some of us were in the legislature busy trying to protect it from people who thought that we ought to cut back on some of what they were up to. But it is a great pleasure to have someone who has dealt with chronic disease, and we're really into now a time when chronic disease is going to become the real issue. I remember when I was in medical school, no one saw a case of tuberculosis. Now, this is the University of Illinois, and Cook County is right next to us. And all 200 members of my class went over to see one little boy who had tuberculosis of the spine. We had wiped out tuberculosis. Well, guess what, folks? You know it's coming back, and it's in lots of places. And that's where you are. You're really in the front lines of a war that never ends, defending the civil society through health measures. And Jim Krieger is a perfect example of it. And Jim, come on up here. And
I suppose